Overdose and its relationship with SCS.
Nurses and all healthcare professionals work hard every day to support the vulnerable people within our communities. For big cities like Toronto, some of these vulnerable people include drug addicts or homeless citizens. In order to support the safety of these citizens, the government and healthcare system have safe injection sites, where addicts would be offered sterile and safe injections to prevent overdose and infection-based illness within the community. Over the past year, 4 of these sites were closed within our city. This decline allowed for a 288% increase in overdoses from June of 2024 to June of 2025, as outlined by CP24. These sites were crucial to the safety of many citizens because they provided medical supervision to people who may be risking their lives. Closure of these institutions are furthering the risk of citizens reusing old needles, which may promote infection or the spread of diseases, even overdoses. Nurses are now being faced with first responder roles within our community to prevent these situations from occurring on the streets of Toronto. Their jobs ranges from providing simple hygiene care to injecting naloxone into patients, which is a life-saving drug to reverse overdose of addictive drugs. For the nurses faced with this responsibility, they are subject to increased stress and moral conflicts. The reducing number of safe injection sites within Toronto will only increase the number of critical situations these nurses face every day. These nurses are battling a crumbling system to protect their communities even by putting their own needs aside. As the overdoses in Toronto rise and support declines from the facilities, the nurses continue to provide care to the vulnerable. Throughout the rest of this presentation, we will look deeper into the health crisis in Toronto and how nurses are providing unbiased medical care to support these citizens.
The article, A Thematic Synthesis of Roles of Nurses at Safer Consumption Sites, Clark and Lucy, 2021, explores nurses' contributions to harm reduction and overdose prevention in safe consumption sites. The researchers analyzed 48 sources, whether they were specifically about nursing or not, and identified 11 clear nursing roles and further grouped them into 3 main themes: reducing morbidity and mortality, creating therapeutic communities, and participating in advocating and researching. The study examined that at these sites, nurses perform multiple tasks such as supervising substance consumption, quickly responding to overdose and wounds, educating the clients on safer consumption, and ensuring that the clients receive both health and social support. As stated in the article, individuals in these injection sites are vulnerable. Nurses ensure a non-judgmental, trustworthy, and dignity-promoting space while advocating for policy improvements and social justice. Nursing roles and safety consumption sites are crucial for the prevention of death due to overdose and the protection of vulnerable populations. This article provides background on how the presence of nurses in safe injection sites directly impacts overdose prevention, and without this, vulnerable individuals are put at more risk medically and socially.
The article Opioid-Related Deaths Among People Experiencing Homelessness 2017 to 2021, a population-based analysis using coroner and health administrative data from Ontario, Canada, evaluates the shift in opioid overdose deaths among people experiencing homelessness and compares them with those who were not homeless at the time of death. The study reveals that between 2017 and 2021, the number of deaths among homeless decedents rose from about 1 in 14 deaths to nearly 1 in 6 deaths. When looking at demographics, most of those homeless individuals who died lived in urban centers and were often between the ages of 25 and 44. PAH also reported having a higher need for healthcare services for addiction or mental illness compared to those who were not PAH. This study also highlights that the location of opioid-related incidents differed for PAH and non-PAH. Homeless incidents occurred less likely in private residences but more often with a bystander who gave naloxone or attempted resuscitation. Lastly, with the evidence provided, this study emphasizes how important it is for healthcare providers to establish rapport with PAH to gain more profound insight about their needs. This encompasses opioid treatments, safe consumption site accessibility, and housing that is combined with addiction and health services, as well as case management to reduce preventable fatalities.
The CP24 article discusses an increase of overdoses after the closure of 4 supervised consumption sites, looking at how systemic decisions directly affect marginalized populations. In this case, individuals experiencing homelessness lost access to safe spaces and medical supplies due to systemic problems. The journalist uses a critical social theory lens to examine how power dynamics and structural inequities impact health outcomes. CST brings focus to the policy change of closing the safe consumption sites instead of viewing the increase in overdoses as individual behavior. In the 2024 study, Booth and colleagues also found that opioid overdose deaths are higher among people experiencing homelessness, directly relating housing instability to increased overdoses. Social justice is also a central theme in the article. The statement, "Our system is very much oriented to dealing with problems and not trying to prevent problems in the first place," displays the need for upstream thinking. The article calls us to advocate for equitable access to healthcare and to create structural change instead of reactive measures. The critical social theory framework strengthens discussion by identifying that systems and policies harm marginalized populations. It also discusses how the overdose crisis is more than a health issue, but also a moral issue. However, the limitations of this framework are that it does not put enough emphasis on the voices of people with lived experiences. Their perspectives, along with insights from frontline workers, would bring more meaning to the issue. In summary, CST and social justice reveal how the overdose crisis is rooted in social inequities.
Hi, my name is Cedric, and I'll be examining cultural considerations between these articles. The CB24 article about Toronto's overdose spike discusses cultural and systemic inequities, specifically how the closure of several supervised consumption sites unjustly harms marginalized populations such as people experiencing homelessness. The rise in overdoses after the closure of consumption sites displays how stigma and misunderstanding can shape public policy. As a result, it reinforces the cultural divide between those who seem to be deserving and undeserving of care. The article reveals how society often turns their back on those most in need in favor of control and order over empathy and inclusion. In similarity, Clark and Lucy's article discusses how nurses at safe consumption sites have the ability to challenge the stigma through compassionate, person-centered care. The research allows the nurses not only to provide medical support, but also act as advocates who generate a sense of dignity, safety, and belonging for people who have been marginalized for a while now. The emphasis on culturally safe care is heavily exclaimed because it's care that respects a person's background, trauma, and lived experience, which transforms how people view themselves and how society views them. In another connection, a study in Ontario from Booth and authors found that people experiencing homelessness are dying from overdose at increasing rates, all linked to trauma, social segregation, and barriers to healthcare. It also notes that Indigenous and racialized people are often left out of official data, showing how their struggles tend to be overlooked. Together, these sources come to reveal that the crisis isn't just about health, it's about how society would go about seeing and treating people in need. The CB24 article's story connects with what the peer-reviewed articles discuss: the immediate need for compassionate inclusion and cultural awareness in public health. Real change requires listening to the voices of those most affected, valuing human dignity over social stigma, and constructing a culture that sees care as a collective responsibility held instead of an individual burden.
Hello, my name is Janaya, and I will be examining the nursing implications surrounding safer consumption sites and overdose. The nursing implications I will be discussing appear both clinically and socially, directly affecting how nurses respond to and support those with drug addictions. Clinically, nurses play a direct role in the development and operations of SCSs. According to Clark and Lucy 2021, nurses are critical in the reduction of mortality and morbidity. They monitor vital signs, assess unconscious service users, secure service users' airways, and administer oxygen or Naxalon when needed. Recognizing signs and responding quickly is one of the most crucial roles nurses play in SCSs. Socially, the role nurses play acts to reduce stigmas that are associated with drug use by creating safe, non-judgmental environments where those affected by drug addiction can access safer consumption sites services while gaining education, support, care, and guidance, also provided by nurses. According to Clark and Lucy 2021, nurses may find that creating a shame-free environment increases their ability to develop therapeutic relationships with service users, or that teaching safer injection techniques reduces wound and infection rates in their practice. But why should we care? Nursing interventions don't just save lives, they promote care and trust while allowing vulnerable groups to receive the care they deserve. They connect communities and people that are in them. And at these sites, client-centered care, compassion, and advocacy are not only needed, but are inherent to all nursing practices.